In my last video, I talked about testosterone pellets as them being my least favorite, basically, way of replacing your testosterone for a bunch of different reasons. You can go back and listen to it. So in this video, I want to tell you what my preferred method of testosterone replacement therapy is in women. And that would be injectable testosterone cypionate. And so typically it's carried in a grapeseed oil, and you inject it either into your muscle or into your fat tissue. So I prefer fat tissue because I don't want a great big needle and to have to administer that to myself. That doesn't appeal to me, but many women do without any problems at all. Doesn't hurt. It just kind of gives me personally the heebie-jeebies a little bit, but I have no problem injecting into fat tissue. So I do fat tissue, but many can do in intramuscular injectables. And we see in our clinic that it definitely raises levels better than cream does. So when we do an equivalent of dosage, we see that injectables work better at bringing your levels up. Now, some women, they don't want to do needles, and so they prefer the cream. And then we typically will just dose it a little bit higher in order to get them to a good spot with their testosterone level. Now, every woman is different because I always say that. Please don't take this all as like, okay, well, if Karen says, then this is what I'm going to go do, because each person is going to need something different in a different amount. Some women will push down what's called the 5-alpha reductase pathway more so than others. And that means that you will convert your testosterone into a stronger androgen called dihydrotestosterone. And that can give you the negative masculine features that no woman wants, like growing whiskers on your face, losing your head hair, getting oily skin, even growing a little bit on the clitoris. So your clitoris can actually grow in size if you are getting too much testosterone and you push highly down that 5-alpha reductase pathway. Now, there are some great medications and over-the-counter supplements that can help block that pathway. So if you are experiencing androgenic symptoms, there are a lot of things that you can actually do to help prevent that so that you can get the benefits of your testosterone without getting those androgenic symptoms. And so we prefer to use injectable at our clinic, but we're also very open to also using creams. We never do oral. Oral testosterone, just like oral estrogen, is not preferred. It raises your sex hormone binding globulin, and it can also create issues in your system. And that why would we do that then if we can use a topical application? Some women actually even prefer to apply their testosterone cream right actually inside the vagina. That works for some women. It helps with lubrication, helps with bladder control, and it helps with sexual function. So a lot of women really like that too. So there you have it. That's my preferred method, in intramuscular injection or subcutaneous, and then after that, cream, topical cream, either inside the vagina or on your labia or inner thighs is my preferred methods.